All right, now we're going to talk about a clinic that has several different medical services that they offer, all at one location. Let's take a look. I recently had the opportunity to visit North Florida Medical Center and Back and Neck Institute. They pride themselves in their ability to offer a vast variety of services for so many different types of patients, all at one location. My visit started with Medical Director Dr. Castile. He provided me with an overview of the clinic and his services.
My job is to supervise the clinicians that are actually working at the clinics and set up protocols that they follow that are within their own means of treatment and within the parameters of treatment that they were trained for. I see patients from all walks of life and all ages. In family medicine, we are trained in pediatrics, adult medicine, we do GYN, we do pain, musculoskeletal. We have to be a jack of all trades in family medicine. What's most interesting and most wonderful to work here is that I have modalities in different specialties and different specialists that I can rely on to help me do my job. We have a full-time chiropractor who's working with us for musculoskeletal issues. We have a full-time physical therapist because the majority of patients that go see family medicine is sometimes orthopedics or joint-related or pain-related. And when conservative measures fail, we go ahead and we refer to Dr. Khanna, who's our pain management interventionalist. And she gets to do procedures on people to make them feel better and return to their activities of daily living with less pain. Think about your own family members. They don't want to go from clinic to doctor, multiple appointments, multiple days missed from work, when you can get a lot of things done in one location right here.
After meeting Dr. Castile, I wanted to experience the clinic from the perspective of a patient. So hypothetically, we came up with the idea that I had back pain. And if that was the case, I would meet with Dr. Adam Bordes, the chiropractic director. He explained how the clinic had a different approach.
Well, chiropractors traditionally, they're known for just treating back pain or just treating headaches, but there's a structural component too. You know, there's a lot of people, it's not just about pain, it's about how does that pain affect your life. And that's really a big part of the treatment here. We're treating people, we're not just treating conditions. So when someone comes in as a chiropractic patient, there's obviously a multifaceted approach because I can adjust somebody all day long. I get somebody on the table, they might feel better, but structurally, what's gonna happen afterwards? And that's where physical therapy comes in. You know, getting you adjusted is one part of the equation, then handing you off to the physical therapist, that's going to help build the strength and help continue the therapy effort.
Great, and then who's that?
That would be Mel.
Hey, how you doing?
I'm Mark, nice to meet you. I'm Melanie, the physical therapist.
Melanie Jordan, the physical therapist, shared notes with Dr. Bordes about my back, and then she introduced me to some new stretches to help me. Melanie explained the advantages of working with physicians.
I mean, if we have patients in who maybe aren't progressing as quickly as we would like, or we just want to have a chat about, or maybe a second opinion, normally we'd have to refer out to a different office, and that might take a long time for them to come back to us. Here, we can just walk down the corridor, knock on the door of the person we want to speak to, and we're done in 5 minutes. And we really feel that means that we can offer a proper team approach to our patients.
After my PT session, Dr. Castile caught up with me and explained another important service offered, pain management. But what if I had pain that was really intense and wouldn't go away? What would be a next step?
Well, the next step would be interventional pain management. Physical therapy would only get you so much. The family medicine conservative approach will only get you so much. And then chiropractic may get you to a certain point. But there are some patients that need further, something that's deeper, like a joint injection, whether it be in your back, whether it be in your shoulder, in your knee, somewhere where you need some intervention. So that's when we would introduce you or set you up with Dr. Khanna. She's an interventional pain management physician, board-certified anesthesiologist.
Dr. Khanna provided an overview of her field of medicine.
I see mostly chronic pain patients, and sometimes I come across acute pain patients too. In this practice, my role is to see the patients who have passed through all the non-invasive treatments, conservative management of pain, and yet they still have pain. That's about 20% of the population, pain population, suffers with chronic pain. Doesn't matter what you do, the pain will persist. Those are the people I see, so I'm like last resort.
Overall, this was a great experience, and I could clearly see how having all these medical services and professionals at one clinic is convenient to the patient. I see why they have the slogan, bringing the care back to healthcare. To learn more about North Florida Medical Center and Back and Neck Institute, visit them online, www.nfmih.org. nfmcjax.com or call them at 904-518-6511.